everyone, my name is Mel B. I'm one of the family nurse practitioners here at SkinMD, also one of the Biote providers, and I'm here with one of our patients today.
And I'm Wendy, and I am a health and wellness advocate for women.
Okay, Wendy, so when did you start your Biote journey, and why did you start? What were some of your symptoms, and what were you looking to improve with Biote?
Well, I started my Biote journey about 18 months ago, and I was experiencing severe menopausal symptoms. I lost my zest for life, basically, and I had no concentration. I was having severe night sweats all the time, 2-3 times a night, hot flashes, knee and joint pain, just you name it, I had it. I was like falling apart at the seams. And then I found Biote, and my life forever changed.
So how did you first find out that you were a candidate for bioidentical hormone replacement therapy, and what was your first experience like?
Well, I found out because I made an appointment for a consultation. My labs proved why I was a candidate. It just solidified everything I was feeling. And so now I was so relieved actually to find out that that was the root of my problem. I couldn't wait to get started.
So Wendy, what was one thing that changed for you that you didn't realize you were lacking?
Oh boy. Well, one thing I noticed is that my libido was turned on again. And I actually, being single for 7 or 8 years or so and being really content and hadn't really thought about it. But now I'm thinking, maybe I think I want to date again.
I love that for you. What was most surprising for you about Biote?
I'll have to say the most surprising and exciting thing for me was how quickly I reacted to bioidentical hormone replacement therapy. It hit me in 7 days and I was flying high.
What symptoms needed improvement?
Well, what symptoms didn't need improvement? All of the above. I just needed help in all areas with my hormones.
We touched on this a little bit earlier, but how long did it take for you to feel the improvement?
Well, about 7 days, I started feeling a little pep in my step again, I guess I'm going to say. I was in disbelief at first. I thought this is too good to be true. I wanted it so bad. I wanted to feel good so bad that maybe I was imagining it. But I said to my daughter, I just feel like I want to go outside and do cartwheels with the kids. She's like, go, go! It was just what I was missing so badly in my life. Wendy was coming back to life and it just felt amazing.
Life-changing.
Yeah, life-changing, absolutely.
How was the healing process for you? And did you have any downtime afterwards?
Well, no, actually, I'm one of the lucky ones. I guess I didn't have any side effects at all. I had no bruising, no swelling, but I followed the protocol. I wanted to go back to the gym because I was feeling amazing, and I was just excited about my journey. So I went and I did upper body and strength training.
No lower body.
No lower body at all. No squats, lunges. I followed the protocol, and but I would go out and go for a walk in the afternoon because it just made me feel great.
So I think what might be stopping a lot of people from starting their Biote journey is they're a little bit worried about the potential side effects.
Right.
Can you speak to that a little bit?
The side effect that I experienced was what they call stacking, when you have a little bit too much testosterone. And I kind of blame myself for that, being a little bit excited. My last provider, who's just retired, and she was a wonderful provider, she was going on vacation. I called to book my next pelleting, and I could either choose to go a little bit early or a little bit later. And I decided to go early, and it's my own fault. Just being so excited of how I was feeling, I just wanted to keep it coming.
Sure.
I went a little bit earlier than I should have, and I had a little bit too high of a dose of testosterone. And for me, the side effect was I was just exhausted again. My body was kind of like stepping back, saying, no, no, girlfriend. So now I know to wait the 4 months, and I'm going to be fine and not push the envelope.
How did you find SkinMD, and what brought you to me?
Well, my daughter was in business development with the SkinMD team, and she was the one who referred me to SkinMD very highly, and she knew you. She thought that you would be a great fit for my personality, and she was spot on. It was a serendipitous moment in my life all the way around, because I always say the success of your journey is all about having a great connection with your provider. So thank you.
Thank you, Wendy. Can you share how having regular blood work has changed your Biote journey?
Yes, absolutely. Well, SkinMD providing me with routine labs is exactly the reason why I chose Biote as my provider and you as my provider. Honestly, working with a provider who monitors my labs and makes decisions with me is equally as important to my successful journey with Biote.
Definitely, looking at how you're feeling in addition to the numbers on the paper.
Yeah, and it's so important to me, and this is what happens when we get together and we talk before I have a pellet. We just discuss everything and we come to a decision together. We're united and we're just looking out for my best interest. And it's just been a wonderful experience.
Awesome. As Biote providers here, we oftentimes at consults tell new female patients that they'll expect to come back every 3 to 4 months for pellets. Looks different for everyone depending on how they metabolize the pellets, what they do in their day-to-day life. What's your timeline, and how do you know when you need your next pellet?
Well, for me, I didn't want to base it on just having a crappy day, because everybody has those. Studying my labs, studying my dosage, and see if we could find my sweet spot. And it did take about 18 months to finally find it after a couple insertions, but now we found it because your labs tell your own personal story. And now I know not to push the envelope and come at 3 months, at 3.5. 4 is my timeline, and it's perfect for me.
You're such a great advocate for your friends and family, posting on both Instagram and TikTok. What has some of the feedback been that you've been receiving from everyone, all your followers?
I am just beyond excited, because whoever thought at almost 64 years old that I was going to use TikTok as a platform to share my journey and my life all about menopause and pay it forward. And I always say, if I can help 1 or 10 or 100 or 1,000, my job is done. I'm destined to do it. It feels amazing to do it. I get the best feedback ever. And I've made so many friends and have so many relationships now. And it just feels amazing, and I'm just going to keep on doing it. Your journey won't be like my journey. There are no two stories alike. It's based on, so many things that come into the equation. Eventually, with a great provider, you'll get a plan in place and you'll have a positive outcome. You just have to be patient. We didn't go through menopause overnight, so we're not gonna, relieve those symptoms overnight either. You know what I mean? So I love doing it, and I'm just gonna continue. Actually, it's a healer for me. And so I just decided, okay, I'm gonna give it a whirl. And then I'd sit on my couch and I did a couple more, and they were like 1,000, 2,000 views. I'm like, this is fun. And I always say, send me a private message. I will, get back to you as soon as I can. And if I can't help you, I will send you to somebody that can help you.
Wendy, thank you so much for joining us here today at SkinMD.
My pleasure.
We're so happy to have you as a patient. We're so glad that you found me here and us at SkinMD.
I'm so happy to be here as a patient with you. It's been wonderful.
Do you want to share with everyone your TikTok and or your Instagram so they can give you a follow? And
they're both the same. It's at Aloha Mom. It's ALOAMUM. At Aloha Mom on Instagram and on TikTok. And on Facebook, I have a page where sometimes people will ask if I will post their favorite video, and then it's shareable. So I have a small page there as well.
Awesome.
Yeah.
Awesome. Thank you, Wendy.
You're welcome. Thank you.